Today's guest is Dr. Kenneth Kim. Now, I'm from LA. I lived in New York for a few years, so I'm familiar with the hustle and bustle and the fast life and the extravagant life that these cities can provide for people and the cultures that it creates and fosters. Also, myself personally, I've had a few surgeries, not elective surgeries, which is what this episode is about, but I'm familiar with the feeling and the dread and the pain that comes from a surgery, especially when you're given anesthesia and you have to be put under. What makes this episode fascinating and why you as an entrepreneur is going to want to listen is because of the way this innovator, Dr. Kenneth Kim, looks at his industry and how he's bucking the status quo and encouraging that we all work towards doing a little better because we now can, instead of resting on our laurels. Also, if you yourself have ever considered elective surgeries, this is an episode for you to listen to the best of the best. And when I say the best of the best, I'm not saying that with hyperbole. I've looked at his credentials. I did a lot of research in preparation for this, and then our conversation went somewhere else entirely. But that's how you know it's going to be a good one. So if you're interested in any kind of elective surgery, you're about to listen to one of the best to ever do it, break down not only their philosophy, but also tell you how you can do this. And more often than not, especially if it's an elective surgery, like he specializes in, not even have to bleed, and why he prefers it that way. So without further ado, Dr. Kenneth Kim. I feel fortunate to speak to you, and I'll tell you why. Okay. I myself have had plenty of surgeries. I know I look young, and they weren't they weren't elective surgeries. They were necessary surgeries. And I did have to go under, and some of those things don't always turn out positive. Right now, what we're talking about with you is elective surgeries and things of that nature. But I like where your direction and the attitude that you have things positioned for yourself are, specifically because of your background too. See, when I was looking into you, I saw the extensive education that you have and the amount of innovations that you've developed yourself in your own field of work. So in order to bring the listeners up to speed so they understand exactly how much weight your words carry, I'd like to know, can you sort of break down some of the things I think that are like top of mind that would help people understand exactly what your background and education is and why it's so, and even work experience and what you've done so that people understand sort of where this is going?
Sure. So I went to Yale University for medical school. And then I went to, and then I did research there while I was in medical school. I spent an extra year doing molecular biology, basic science research on tissue healing, tissue regeneration, and tissue growth. So very, very molecular genetic research, cellular research. And then I went to residency at Northwestern and for plastic surgery, plastic and reconstructive surgery. And there, I also did another year doing research in Switzerland, doing engineering research, because I felt that even though my background is in molecular and cell biology, I felt that to have major surgical innovations, you have to go very microscopic to very macro. So you have to be essentially vertically integrated. You have to understand the whole gamut. And so I did that. And then I spent also a lot of time in South Korea, which is like the leading country in plastic surgery. And then I collaborate with surgeons throughout the world as well. And currently I'm an assistant clinical professor. I have my own practice in LA, in Los Angeles, but I also teach as a clinical assistant professor at UCLA plastic surgery. And I also teach at Seoul National University, which is the #1 university in South Korea. So I do enjoy teaching, and I do a lot of research. And my research and innovation has always been in terms of how can we deliver better surgery? Because if we think about innovations in every field, not in medicine, just in life, there's been so much innovation. But when you think about innovation in medicine, we think, okay, in medicine, maybe there's some drugs or vaccines or what have you. But in surgery, there hasn't been a groundbreaking innovation that has really took in shape. What I mean by that is the way we operate is essentially the same as the way we've been operating about 100 years ago. So what is that? We put somebody to sleep, and then we cut them, and then patient wake up with pain, and then we give them pain medications, opioids, and then we're like, okay, you're on your own now. And then so what is wrong with that picture? Well, the problem I see is that surgery is by inherently surgery is traumatic, and so patients experience a lot of pain. And number two is that afterwards, they're taking these pain medications, and people are wondering why we have opioid addiction, and a lot of it is iatrogenic. What that means is that a lot of them is because of when the patient had surgery, we give them pain medications, these opioid pain medication, and these people who you would never expect them to be addicted to pain medication, they become addicted. These are like these are people with families having, just the normal Americans. And it's not in America, it's throughout the world. And some people are more prone to addiction and some people are not. And so we have that risk factor. We have that factor. And then another factor is the risk of surgery itself. So if we look at surgery, what is the risk of surgery? There are two types of risk of surgery. One is an anesthetic risk, and other is a surgical risk. So let's talk about anesthetic risk. So anesthetic risk is you hear about in social media or on news, some celebrity, never woke up from surgery. Yeah. And somebody died of doing even things like even breast augmentation or what have you. And you're wondering like what happened? And these are all anesthetic risk because they had an adverse reaction to, from the anesthesia. So what can happen? People can develop a blood clot. People can have a heart attack, basic, MI. They could have a stroke. I mean, there's many adverse events that can happen. They could, have malignant hypothermia. But these are things that are unnecessary risks that these people are taking. Now, what are the other risks that we don't really talk about? And the big thing is memory loss. So this is something, when people ask, so what's the risk of surgery? People think about, as I just mentioned, blood clot, having stroke or heart attack, things like that. Sure. But memory loss is something that people don't talk about and people don't know. And the data is showing that general anesthesia and IV sedation that is lasting more than 2 hours will kill neurons, which are cells in the brain, specifically at the hippocampus, which is the memory forming part of the brain. And so you lose memory. And so basically it kind of sets you up for dementia in the future. So if you're a young person, you realize like, oh, my memory is not quite as good as it used to be after prolonged surgery. And then if you're over 60 to 65, then you really feel it even more. And then your onset of dementia is getting, it's going to come faster. So, right now we're living in 2023, but then the projection is that by 2050, the rate of the incidence of dementia is supposed to triple. Like not double, it's supposed to triple the amount that we have right now.
Oh, wow.
So it is becoming, the dementia is a real big issue for us right now. And I think that I just want the audience, and I think just the people in general to understand the risks that are involved. And then the other risk is now the other component is surgical risk. And the surgical risk is a surgeon's error. So what is surgery? Surgery is is something that a surgeon does with his or her own hands. And anything where you're dealing with mobility or movement, where your eye and your hands are moving, one of the most important thing is visualization. And if you look at people who get into accidents, like let's say Kobe Bryant, the helicopter, the person who was flying the helicopter for Kobe Bryant, the poor visibility is what confused him. And you look at JFK Jr., who got into a plane crash, again, poor visibility. So same with surgery. And what has happened is that in surgery, we have accepted bleeding as a natural part of surgery. So because our body is full of blood vessels. And so if you're cutting blood vessels, then the problem is that it stains the surgical field. What that means is that where you're operating, everything kind of turns red. So if you watch, then what the problem is problem with that is that the surgeon really doesn't get a clear visualization. It's like driving in a fog or driving in a heavy snow. It's very hard. And we kind of accepted that as that's just the way it is. Okay. And then if you ever watch like movies or TV shows about surgery, you see a little bit of smoke coming out. And what is that? And these are we're like burning tissue. We're burning all these vessels because patients are bleeding, or or you hear, oh, the patient's bleeding and this and that. And so, what I'm trying to make surgery go towards is how can we operate so precisely, ultra precisely, where you don't hit these blood vessels. Because if you hit blood vessels, you're going to have increased surgical error. And if you hit these blood vessels, then the target cells, they don't get the nutrients that they need. They're not getting the oxygen. The red blood cells can't come in because it's the road that is bringing all the supplies. And so imagine you're just bombing these roads. Well, the people living there, the villagers, can't live there because the food can't come in. So it is great. You have done your job of killing the terrorists, to just say as an analogy. Right. But if you bomb all the roads, now they're going to be suffering. And so what I'm suggesting is that let's not do collateral damage. And I think right now, surgery, we have done so much collateral damage. And, when I watch football, NFL football, or they will talk about, oh, that was a surgical strike. That was a surgical delivery or something like that. It kind of makes me laugh because surgery hasn't really done that. Because if we were that precise, then you don't have to knock patients down. You don't have to knock patients down, and you could operate without causing bleeding because the surgery is ultra precise. So if you're operating at an ultra precision level, then you could operate, especially, so I'm not proposing to do this for all surgeries. I'm proposing to do it on elective surgeries. And because, there are elective and there are non-elective. So if you have trauma, let's say you get into an injury, or God forbid somebody has cancer, okay, you know what? Just do it. Let's get that job done. But if it's an elective procedure where you are planning where you're going, elective means you're planning to do something. You elect to do it. So you could map out exactly how you're going to plan your surgery from the beginning of the incision to the closure. So the analogy is like being a race car driver versus an off-road driver. So if you're doing trauma, or where you don't know where the injury is, or you're doing cancer surgery, you don't know where the cancer has spread, you're going off-road. You have to kind of navigate your way in during surgery. So I'm not proposing to do it for that. But if we're talking about an elective surgery, that is a track. You're driving in a track. So you know what which turn you're turning, what the angle of the bank is, how fast you could hit it, so you could plan everything. And that's what I'm saying is that surgery has to get to that next level. And we've been expecting and demanding innovation and excellence in other specialties, except for surgery. And why? And I think the reason is because patients just think that this is just the way it is, right? And unless we demand something better, it's not going to happen. And what I'm saying is that you can do it like this. It's just that it's not commonly done because it takes obviously longer. The surgeon has to study the track in detail. And if you're going to, and then going back to the analogy of, like, let's say you're trying to rescue a hostage, or you're trying to invade and get rid of bad actors somewhere. The easiest thing to do is just bring a bunch of Navy battleships
right,
and do an amphibious assault. You just bomb the hell out of it. And then after that, you send in your aircraft carrier, because you don't want your aircraft carriers to come in because you don't want them to shoot at the aircraft carrier, right? So, and then you bring the aircraft carrier, bomb some more, and then you send in the Marines, and then you send in the Army. And then by the time the Army comes in, they're walking in. Okay, this is not like D-Day during Normandy. They're going to be walking in because the bombing is going to be so intense. And I feel like what we're doing to our patients is that, we're knocking the patients down, right? Knocking them out. And so the patients think like, oh, that's great. I'm just going to go to sleep. But what they don't understand is that when they're going to sleep, your body feels the pain. So if you don't think your body feels the pain, there's been a study looking at babies, infants undergoing heart surgery, and studying why do some babies who undergo heart surgery, these are the same babies, age group, and all the variables similar, going through the same heart surgery, but why is it that certain babies survive and certain babies don't survive and they die? So what they did is during the surgery, they measured all their hormones, the lab values, everything. And there was only one thing that made a difference. And that one thing was that the babies who survived had less stress hormones that were activated versus of the babies who died, their stress hormone just went off the roof. So what does that mean? It means that just because the baby is put to sleep does not mean that the body doesn't feel the stress of cutting. So our body feels it. It's just that when you're older, a lot of times your body can handle that cutting, right? But it's still not good for you. And so, just like, and then you say, well, why is that? Why did one group A baby survived and group B didn't? And as I mentioned, this has to do with stress level. And we all know that certain people deal with stress much better than certain other people. Yeah. If you look at fighter pilots, they said that one of the traits of a fighter pilot is they could handle the stress of going, Mach 1, Mach 2 easily. Whereas some other people, it will really frighten them and they will have an anxiety attack. And so those people are not cut out to be a fighter pilot, right? So we have different ways that we deal with stress. And I think that right now, when we put patients to sleep, patients think that everything is fine. And what I'm saying is that you're not fine. The moment you're put to sleep, the anesthetic, and remember, anything going over 2 hours, or if you're doing multiple anesthesia, it is killing neurons, specifically at the memory-forming part of the brain, which is and they don't regenerate. Number 2 is your increased chance of all these blood clots and even microclots. So we talk about blood clots as things that are clinically significant that will make a huge difference that is visible. But there are a lot of subclinical effects, these tiny vessels clogging, the stress hormones going up, and all of that is bad. And what I'm saying is that we don't have to do it that way. We could simply use local anesthesia and numb up that area and then operate precisely so that you're not causing trauma. And the benefit of that is that after the surgery, you're not taking opioid. Remember, we talked about opioid and opioid crisis.
Yeah.
So if the surgery is done ultra precisely, where you're not hitting all these nerves, you're not burning tissue. Burning tissue, I mean, imagine like you get burned on your skin. It is painful, but you're getting burned inside. So you don't burn tissue. Then only pain medication you really should need is like Tylenol for maybe a day or two.
Wow.
So that's the difference of, because our body feels the pain if you hit a nerve or if you have a lot of inflammation. So the fact that you have pain means you had trauma. And the fact that you have bruising means that you had blood vessels that are cut. And you don't have to accept that. That is what I'm trying to say. You could get a much higher level. It's just that, we all have to step up our game to deliver that. Right? Not, it's just like telling a regular soldier, I want you to go be a Navy SEAL or special ops, right? They're not going to be like that from the beginning. You have to get them trained and then let them operate differently. You don't see Navy SEALs just blasting away. Every shot they make, even as they're moving, they're using their scope, right? They're moving with their eyes on the scope. It is very mentally taxing to be running around like that. Versus, if you ask typical, military personnel who are not special ops, they're not going to do that because they have trouble running around, and not falling. You ask them to look under a scope and then shoot as they're walking accurately. Yeah, so
it's a different level. Yeah.
level. Exactly.
There's so many things you brought up that truly fascinated me. For one, just the idea that people ask you if you take any medications, but no one's ever developed a questionnaire to determine your likelihood of addiction. That's something that, like, right off the bat, I was like, I can't believe nobody has done that yet. And while most surgeries tend to be sort of like life-saving surgeries if they're not elective surgeries, even so, I haven't heard of questionnaires like that to determine the psychographic of someone and to determine, the blood levels and, the labs and whatever the correct terminology is. And forgive me for speaking out of ignorance here, but whatever the current terminology should be for being able to identify the tendency for addiction. That's huge. I didn't even think about that, right? And that was just a casual part of the conversation, not even the point that you were getting at. Then the other thing that I think, especially business owners listening and in general, entrepreneurs who may tend to be the more affluent part of society that do have these surgeries in any number of form or fashion, is the fact that you ask the most relevant question: do we have to bleed during a surgery? I think that is profound as far as innovation is concerned, right? Because more often than not, especially in business, people go, well, that's the way we've always done it. And because customers don't ask about it, very similar to the way Apple seems to just do things the way they've always done it. And, every new phone kind of looks like the other phone. And then people just go, well, I mean, that's just Apple. Nobody's pressuring for innovation, for true change, for true development, right? And so I love that you simply asked the most provocative question, which many might even be upset by in your own industry just because you asked it. They're like, hey, come on, man, we got a good thing going here. And you're like, I think we can do better. And I truly believe that stands out and it should be applauded because those are the types of questions that will push things forward. I've always believed that there's nothing worse than the right answer to the wrong question, and which makes it all the more profound when you ask the right question. Do we have to bleed during surgery? As somebody who was put under twice, believe me when I tell you, I have no idea what the repercussions are, but I know I'm not the same, And so to hear someone thinking this way and trying to push this envelope forward, I can't tell you how much I appreciate that, because I don't understand if when I'm older, these things will have repercussions. You know what I mean? And all of that should come into account, because you're absolutely right. There's true trauma taking place in the body. Just because you were asleep doesn't mean you didn't feel it. And to know that there's the possibility that we'd be losing memories, on top of the fact that currently right now, there's the silver tsunami coming into play, right? You want to add even more to that. I'm speaking a little out of my depth here, but I know enough that there is an aging population, right? There aren't as many medical professionals that are as trained, that have a background like yours. So you're asking all the relevant questions and you're bringing up really valid points. So given that you have their attention right now and you're talking about that these things are things that you're working towards, what are the developments that have happened towards that goal?
Yeah. So, just to kind of elaborate more, you brought up this Apple. So I'll give you an example. So I have quite a bit of Silicon Valley, a lot of engineers females working at Apple. These are, people working in tech, engineers, and software programmers. And these women are very busy. And, they kind of know each other. They have friends who work for Google. They have friends who work in other tech industry in Silicon Valley. And so what they do is they'll fly over and then they'll have surgery with me. They'll do, let's say, a breast augmentation. And then that night, they'll go out with their friends in LA, catch up with their friends in LA. And then the next morning, they'll fly back to San Jose or San Francisco.
Wow.
So compared to typical breast augmentation, where you're sore, you have to be wheeled out, right? You're groggy, you're nauseated, you're exhausted, you get wheeled out, and then you're in pain for about a week or so. And you can't even go to work for about a week. You can't move your arms. Compared to these people who are going out to dinner that night, and then flying back the following day, and then going back to work the following day after that. So, wow. We have, like LPGA pros, we have college students who are approaching that level. And for them, like, our movement is really important. And they understand that they don't want their body to undergo a lot of inflammation, because athletes know that inflammation is bad for their muscles and their tendons and all that. And so these people, you could, as I said, if the surgery is that precise and you don't create inflammation, then you're not taking pain medications, and you have essentially very, very minimal discomfort, and then they go right back to work. So and then you're mentioning about, these entrepreneurs and people are busy. I always tell them, they say, what do I have to prepare for surgery? And I said, there's nothing to prepare, because typically you went through surgery, you can't eat after midnight, you're dehydrated, and all this and that. Whereas here, you're literally, because we're not changing your physiology. You could eat your breakfast, you could do whatever you want to do. And if the surgery gets long, we even have you take a break in the middle of surgery. It's because you're mentally alert, you didn't lose any blood. Not any, but you lost so little blood that you're not tired. So you could just walk to the restroom. You could do whatever you need to do. So if you're doing, let's say, a facelift, I do one side of the face, and then we give you a break. So I give you about 45 minutes to an hour where you could walk to the restroom and you could FaceTime your friends. I mean, I have people who are even working in the middle of that break because they're so busy. And
wow.
So, yeah, exactly. And then once you're done, there's no such thing as wheeling you out, because you walk out immediately and you walk to your car. I mean, you don't drive, but why are all those important? Because remember, it's not good for you to be lying down like that, because we know that even you flying on an airplane for a long distance, what do they tell you? Walk around a little bit, right? Because even if you fly for like more than 6 hours, you could develop a blood clot, right? I don't know if you or your audience will know about that, but you're not, our human body was not meant to be just lying down straight. And then there's a difference between lying down when you're asleep versus lying down when you're under general anesthesia. Because if you're under general anesthesia, you're not moving. The muscles are not moving, and often and a paralytic is given, so your muscles are not moving. Versus when you're sleeping, you're moving, you're twisting back and forth, so you're still moving, and so the vessels are still pumping, and so that's very important. And then talking about dementia, so the data is that we have done studies, not me, but these are neurologists, scientists, anesthesiologists. They have done studies looking at every animal species, including insects, and have shown that these anesthetics are killing neurons at the hippocampus to a significant degree. I mean, these are not like minor effects. I'm talking about major. And one study was looking at an animal that was, we do a lot of studies, on animal studies, and then looking at what a 6 hour of general anesthesia would do, and it activated caspase enzyme. And what this enzyme is an enzyme that auto-digests itself, which means that it is killing itself. It's going through apoptosis, which means you are just basically saying, I'm committing suicide. My cells are now is dying. So, and it has gone up more than 50%.
Wow.
So that is significant, more than 50% of them. So, I mean, and what's really unfortunate is that if you Google it, then, a lot of the data will say, oh, it's not fully yet conclusive. And the reason why it's not fully, some people may say that, is because the human studies are hard to replicate, because you have certain people who have tremendous amount of brain cells, and then we have certain people who have less brain cells. And so obviously, if you have a lot of brain cells and you knock out 50% or you knock out 30%,
right,
you don't have a bunch of reserve, right? So it's like saying, you get a very strong person and you weaken them a little bit, they could still run and carry things. But if you have a frail person and you weaken their muscle, they're going to have a hard time, forget carrying, they're going to have trouble carrying themselves, right?
Yeah.
So what we have is that we have what's known as a physiologic reserve. And I find that, unfortunately, people will try to find ways to make things murky or cloudy and trying to say, because there's always people who don't want this agenda, right?
Yeah.
And so, with anything in science, and I think Elon Musk said this. He said that in science, you always find an opposite view because there's somebody who doesn't like what you're trying to do, right?
So true.
What I'm saying is that if every animal study is showing it, then how can we argue with a very objective study? And then you bring in a little bit of this human study, and by saying that, because of this, the animal studies don't matter. That means that everything we have done in science so far, biologic science, is not correct because we always do it on animals.
Right.
We can't study on humans, So, I find that argument to be just very flawed. Yeah.
Yeah, no, there's definitely, the probabilities are more in favor of this being a fact. And you're right, politics always seems to get in the way. It's not just in science, right? Business is the same way. There's certain people who don't want changes to the supply chain or, what have you. And it's like, there's always going to be some actor who will prefer things to stay the way they are. And as an innovator, usually you don't have any problem with letting them know. I don't think it's going to stay that way for long. You're either going to get with it now, or you'll be the last one to adopt it only because you had to. But change usually happens because it's the only constant we have in life that we know of.
Right. And I just want, your audience to just understand the important concept. And then what the concept is that we should live our life the way we were designed to live our life. And what I mean by that is that human beings were not designed to be paralyzed, and we were not designed to put to this type of deep comatose state, this deep sedation. Because, when we think of anesthesia as just going to sleep, but when you're asleep, if somebody screams or somebody shakes you, you will wake up. But in surgery, you're put into sleep so deeply that even if somebody's cutting into you, you don't wake up. Right? And remember what I said, your body is feeling that. Remember I was telling you about the kid, the infant who was going through heart surgery?
Yeah.
They're doing that. Your body is releasing stress hormones like crazy. So your body is feeling it. And that's why you wake up with pain, right? You wake up with pain, and that's why they're giving, the first thing they give you is pain medication when you wake up. And then you go home with pain medication. So what I want people to understand is that we should try to live our life the most natural way possible. Now, does that mean that we don't advance? Does that mean that we go back to the Stone Ages? No. So what I'm saying is that let's have that philosophy, let's have that principle in mind, and let's overcome it. As human beings, we need to meet the challenge. And what the meaning of the challenge is let's not disturb the rest of the human being to go after something. And just like the analogy I was giving about special ops, right? If we have to shoot missiles and bomb the hell out of a city to, kill some bad, people there, terrorists, you're doing too much collateral damage. And, I think that we could do it more, discreetly and more elegantly, and we should demand more of an excellence.
I'm all in favor of that. You're 100% right. If we consider the origins of a lot of how this work in surgery started and just the medical science in general, right? Ripping the body up and seeing what's under there. We've done that. We've got hundreds of years of data. We've looked at, you're right. At what point do we begin to create elegance in what we're doing as opposed to sitting and resting on our laurels? And I believe this is truly a conversation about an innovator looking at an industry and wanting to push it forward. And you could just be the very best and get all your recommendations and you could just live just fine off of that. And I'm sure you're doing quite well. But the fact that you want to preach the message, share the message, help people understand how valuable that is and that it is possible, for me, that's super important because that just goes to show that you're saying, hey, look, I could be great, but I know that we could all be better. And so I'm going out of my way to make sure that happens. And I think that's an important characteristic to understand as the guiding philosophy. Like you said, if we're going to use a North Star, why don't we aim to have things happen as naturally as possible? We have the technology, we have the data, we have the tools. And we can make better tools to collect better data, to continue to improve and make a more refined and a more elegant experience for elective surgeries. And all of those innovations are likely to then fall into the other surgeries that are life-changing surgeries, where we can minimize collateral damage. And as someone who's had nothing but collateral damage, which is how my surgery journey started, I am more than thrilled to know that someone like you is pushing that envelope forward. So with that said, in the essence of time and respecting it, where do you want the listener to go to learn more about you or to sign up and work with you?
Sure. So they could go to my website. It's drkennethkim.com. So drkennethkim.com. And then they could find more about it. And I just think that, they should ask their surgeons to say, hey, can this be done with just local anesthesia while I'm awake? Because again, it is something that it can be done. It's just that, obviously it's going to take a little bit longer for the surgeon and they have to be a little bit more precise, more attention to detail. So I would suggest that.
Right on. No, I'm truly grateful that you're gracious enough to take some time to break all this down and explain it. Again, it's a little out of my own depth, but I'm truly fascinated by it, especially having had firsthand experiences where the surgeries were less than ideal, right? And even though it's not necessarily an elective surgery that I had, understanding that those are the developments taking place, I can correlate it to the way there are innovations being done in certain industries that eventually impact. Like, for example, we can look at the large language models with AI and what have you, and how much that's going to influence pretty much every other industry as things move forward. And that's just one of the models using artificial intelligence, right? So for me, this conversation was truly engaging and exciting, just knowing those are the kinds of developments and spirits and mental frameworks and philosophies that are guiding the development of that. For me, that means everything to me. So, Dr. Kim, thank you so much.
Of course. And yeah, the way I look at it is that, we should always strive for the ideal. I just think that when we live life, we should always strive for the ideal, and what is the ideal of everything, not even in medicine, not even in surgery. And in life, I think is let's bring in the good and let's take away the bad. Let's do good things and try to not do bad things. That should be the guiding light, right?
Yeah.
We have so much of, craziness and we have conflicts, this and that. But if everybody says, what is a good thing? Like, what can we do to help each other, help us, help the environment, help the world? What are the good things? And what are the bad things? Let's try to not do the bad things. And, let's try to make innovations and do it so that life becomes better. And I think what I liked what you said was this refinement, right? One of the huge aspects of progress is refinement. And I think, refinement is, that kind of, we don't want all the negative things that comes with it. And I think that should be for everything. Yeah.
No, I'm a big fan of your personal philosophy and how it relates to your work. And I can't thank you enough for stopping by. It means a lot to me. Thank you.